Acute glomerulonephritis clinical manifestations is between 5 to 12 years. Is between 5 to 12 years. Now, important clinical manifestation: history of throat infection. History of throat infection 1 to 6 weeks prior to disease. Passage of scanty high colored urine. Scanty urine. Passage of scanty high colored urine. Passage of puffiness of face. Puffiness of face. These are three important clinical manifestations. History of skin or throat infection 1 to 6 weeks prior to the disease. Passage of scanty high colored urine and puffiness of face. Other more clinical features: fever, non-specific symptoms like malaise, lethargy, headache and vomiting. Malaise, lethargy, headache and vomiting. Sometimes patients present with features of complications like sudden respiratory distress syndrome, acute left ventricular failure. Acute left ventricular failure, convulsion and unconsciousness, hypertensive encephalopathy, complete cessation of urine, acute renal failure, complete cessation of urine, acute renal failure. Now, physical examination. Face, puffy, important physical examination: puffy face, blood pressure high, BP high, and severe respiratory distress. These are important physical examination. Face, puffy looking due to swelling of eyelids and face, mild pallor, then blood pressure high and severe respiratory distress. More physical findings of physical examinations: pallor, skin edema, pallor mild, skin evidence of infected scabies or scar of previous infected scabies, or scar of previous infected scabies, edema present, blood pressure high. Sometimes features of heart failure. The features of heart failure: respiratory distress, severe respiratory distress, respiratory rate increase respiratory rate or tachypnea, pulse, tachycardia, blood pressure high, BP high, jugular venous pressure raised, JVP raised, precordium hyperdynamic, apex beat shifted, gallop rhythm present. Then lung abscess, lung bases, crepitation on auscultation, liver, enlarged tender liver. Sometimes features of hypertensive encephalopathy. What are the features of hypertensive encephalopathy? Convulsions, alteration of consciousness, and low Glasgow coma scale. Convulsion, alteration of consciousness, and low Glasgow coma scale. Features of acute kidney injury or renal failure. Oliguria, anuria, vomiting and drowsiness. Investigations. Evidence of nephritis, evidence of prior streptococcal infection, evidence of prior streptococcal infections, for evidence of complications. Evidence of nephritis. Evidence of nephritis. Urine RME. RBC cast proteinuria. RBC cast আর হলো proteinuria. Blood for C3 and C4. Blood for C3 and C4. Evidence of prior streptococcal infection. Blood for evidence of prior streptococcal infection. Blood for ASO titer. Blood for anti-DNase B. Blood for anti-DNase B. Blood for streptozyme test. Blood for streptozyme test. For evidence of complications, hemoglobin, serum electrolyte, serum creatinine, X-ray chest, and MRI of brain. Now treatment. Counseling parents about the nature of disease, its complications, treatment and prognosis. Treatment in mainly supportive and includes counseling. Treatment is mainly supportive and includes bed rest, diet, salt and fluid, diuretics, antibiotics, antihypertensive, and finally follow up. Bed rest, diet, protein restriction, no protein restriction 0.5 gram per kg per day. Restriction of potassium rich food and fruits. Salt and fluid totally restricted. Diuretics, furosemide. Antibiotics, penicillin for 10 days. Antihypertensive, nifedipine, calcium channel blocker. Finally, follow up daily to assess clinical response and to identify complications. Difference between acute glomerulonephritis acute glomerulonephritis or nephritic syndrome and nephrotic syndrome. Difference between acute glomerulonephritis and nephrotic syndrome. Age of onset in case of 5 to 10 years, nephrotic syndrome 2 to 8 years. History of sore throat or skin infection. Glomerulonephritis, history of infection present, more pertinent, may present. Extent of swelling usually confined to facial puffiness. And in case of nephrotic syndrome, generalized edema. Ascites usually unlikely, likely. Then urine color, high or reddish and normal. Hypertension present in acute glomerulonephritis, absent in nephrotic syndrome. Proteinuria, mild proteinuria and massive proteinuria in nephrotic syndrome. Urine RME, only RBC and RBC cast here RBC absent, hyaline cast, granular cast present. Serum albumin normal, here decreased, hypoalbuminemia. Serum cholesterol normal, here increased. Serum C3 decreased, here normal. And relapse and remission, rare in acute glomerulonephritis but common in nephrotic syndrome. Acute glomerulonephritis. Acute glomerulonephritis clinical manifestations: age between 5 to 12 years, history of skin or throat infection 1 to 6 weeks prior to the disease, passage of scanty high colored urine, puffiness of face. More clinical manifestations: fever uncommon, non-specific symptoms like malaise, lethargy, headache and vomiting. Symptoms patient present with features of complications like sudden respiratory distress, acute left ventricular hypertrophy, convulsions and unconsciousness, hypertensive encephalopathy, complete cessation of urine indicates acute renal failure. Physical examination: face, puffy face looking due to swelling of eyelids and face, mild pallor mild, skin evidence of infected scabies or scar of previous infected scabies, edema present, blood pressure high, and sometimes features of heart disease. Means severe respiratory distress, respiratory rate increased, tachypnea, pulse, tachypnea, blood pressure high, jugular venous pressure raised. Then precordium examination: hyperdynamic, apex beat shifted and gallop rhythm, lung abscess crepitations on auscultation, lung bases crepitations on auscultation, liver enlarged, tender liver. Sometimes features of hypertensive encephalopathy, convulsions, alteration of consciousness and Glasgow coma scale low. Features of AKI or renal failure, oliguria or anuria, vomiting and drowsiness. Investigations: evidence of nephritis, evidence of prior streptococcal infection and evidence of complications. Evidence of nephritis: urine RME, RBC cast and proteinuria, blood for C3 and blood for C4. Evidence of prior streptococcal infection: blood for ASO titer, anti-DNase B, blood for streptozyme test. Then for the evidence of complications: hemoglobin, serum electrolyte, serum creatinine, chest X-ray, MRI of brain. Treatment: counseling, A, counseling, B, bed rest, diet, protein restriction less than 0.5 gram per kg per day, restriction of potassium, rich food and fruits, salt and fluid restriction, diuretics, furosemide, antibiotics, penicillin for 10 days, and antihypertensive nifedipine and calcium channel blocker. Follow up. Now, difference between acute glomerulonephritis and nephrotic syndrome. Age of onset 5 to 12 years, 2 to 8 years. 5 to 12 years, 2 to 8 years. 5 to 12 years, 2 to 8 years. History of sore throat or infection present in case of acute glomerulonephritis may present. Extent of swelling usually confined to facial area, and nephrotic syndrome generalized edema. Ascites usually unlikely, usually present. Urine color high or reddish color, normal color. Hypertension usually present in nephrotic syndrome or absent in nephrotic syndrome. Proteinuria mild, massive. Urinaremia, RBC cast, hyaline cast, granular cast. Serum albumin normal and decreased. Serum cholesterol normal, increased. Serum C3 decreased, normal. Relapse and remission rare.